Hey lovely people out there, welcome to my YouTube channel and thanks for clicking on this video. In today's video lecture, we are going to start with a very important topic and the name of that topic is drugs acting on kidney. Now जब हम drugs acting on kidney की बात करते हैं, we have one very specialized class of drugs which is mainly acting on our kidneys and the name of that particular class of drug is known as diuretics. So today in this particular video presentation, we are going to discuss about a very important class that is known as diuretics. But before starting our today's video presentation, let me give you a brief review कि आज के इस वीडियो लेक्चर में हम कौन सी चीजें डिस्कस करने वाले हैं. The very first thing that we are going to discuss is about the basic understanding of the term that is known as diuretics. Then the second topic that we are going to discuss is about the basic structure of nephron. Now the question is why we are studying the basic structure of the nephron. As we know कि ये जो class of drugs होते हैं which is known as diuretics, they are mainly acting on our kidneys. And हमने lower classes में पढ़ा है कि जो structural and functional units of kidneys होते हैं we call it as nephron. And जो हमारे diuretics वाले drugs होते हैं they are mainly working on different regions within the nephron. So हमें ये जानना बहुत जरूरी है कि nephron का जो basic structure है वो क्या है. So we are not going to discuss the detailed structure of our nephron. I will just tell you कि what are the main important regions जहां पे हमारे drugs काम करेंगे. The third important thing that we are going to discuss is about the classification of our diuretic agent along with the site of action on the nephron. Now mainly जब हम diuretic agent के classification की बात करते हैं, we can classify our diuretic agent into 5 main categories. Now जब हम वो categories को classify करेंगे, I will tell you कि each class of a drug कौन से site of nephron पे काम कर रहा है. So that is why to understand the basic structure of a nephron is very important. And finally, we are going to start with our first class of diuretic agent that is known as carbonic anhydrase inhibitor. So without wasting any further time, let us understand what do we really mean by the term that is known as diuretics. So as you can see on your screen, the very first question is, what do we understand diuretics? So diuretics are nothing but they are those drugs which promotes the excretion of sodium and water in the urine. So if a person is taking diuretic agent, वो person में क्या होगा कि जो urine output है वो बढ़ जाएगा. And our diuretic agent, it is increasing the urine output by eliminating the more amount of sodium. Now more amount of sodium जब हमारी urine में excrete out होता है that is known as natriuresis. And we know कि ये जो sodium है that is always followed by water. So जैसे ही sodium का elimination होगा in our urine, it will be followed by the water. So simultaneously sodium के साथ water भी eliminate out होगा and this is particularly effect is known as diuresis. And ये जो effect cause करने वाले drugs होते हैं we call them as diuretic agent. Now there is a second important term that is known as aquiuresis. Now what do we understand by the concept of aquiuresis? जब हमारी urine में more amount of water is getting eliminated out or we can say जब urine में water का concentration जब ज्यादा होता है as compared to different electrolytes or we can say solutes, that is known as aquiuresis. So remember कि diuretic agents are mainly working by promoting the excretion of sodium and water and ये ऐसे agents होते हैं जो हमारे urine के output को बढ़ाएंगे. Now diuretic agent, they are mainly working on our kidneys. So now let us move on to our second important segment, that is the basic structure of our nephron. So as you can see on your screen, this is representing our nephron. Now nephron में जो blood लेके आता है that is known as afferent arteriole. So this is our afferent arteriole and यहाँ से blood nephron के अंदर आएगा. Now this afferent arteriole is getting splitted out into many capillary-like system, and all these capillaries together is known as glomerulus. Now ये जो capillaries है, it will rejoin and यहाँ से blood बाहर जाएगा, and this is known as efferent arteriole. Now can you see this cup-shaped like structure? This cup-shaped like structure is known as Bowman's capsule. Now Bowman capsule से एक highly convoluted tube arise होती है, and this particular highly convoluted tube is known as proximal convoluted tubule. This proximal convoluted tubule then will lead to a U-shaped structure, and that is known as loop of Henle. Now ये जो loop of Henle होता है, we can classify them into different region. So this particular region of our loop of Henle is known as descending limb of loop of Henle. Here is our hairpin turn, and यहाँ से ये जो आपको region दिख रहा है, that is known as ascending limb of loop of Henle. Now ये जो ascending limb of loop of Henle है, it can again be classified into two main regions. The very first region is known as thin ascending limb of loop of Henle, and the second one is known as thick ascending limb of loop of Henle. Then loop of Henle के बाद एक और एक highly convoluted structure होता है, and that particular structure is known as distal convoluted tubule. Here is our distal convoluted tubule, and finally we will be having a collecting duct which is also known as collecting tubule. Now ये तो हो गया हमारे basic part of nephron. Now there is a very important term, and that is known as the filtrate. Now what do we understand by the concept of a filtrate? So जैसे ही यहाँ पे blood आएगा, all those blood elements which can pass through this glomerulus and appear in different regions of our nephron, that is known as the filtrate. If you are not able to understand this particular concept, let me give you a easy concept so that you can relate it very easily. हम सबके घर में चाय बनती है. Now जब भी हम चाय को फिल्टरिंग यूनिट के साथ फिल्टर करते हैं, जो चाय पत्ती होती है वो फिल्टरिंग यूनिट पे आ जाती है, एंड जो हमारा टी है दैट इज द लिक्विड वो कप में भर जाता है. सो आफ्टर द फिल्टरेशन जो कप में लिक्विड होता है दैट इज नोन एज द फिल्टरेट. Similarly, apply that particular concept in our concept of the nephron. So nephron के अंदर भी जब blood आता है, all those blood elements which can pass our glomerulus and appear in the region of nephron, that is known as the filtrate. Now एक चीज याद रखना कि ये जो filtrate है, 99% of the filtrate is getting reabsorbed. So हमारा काम mainly है कि how the reabsorption of sodium is taking place. बिकॉज हमने बेसिक में देखा था कि डायूरेटिक एजेंट जो होते हैं दे आर प्रमोटिंग द लॉस ऑफ सोडियम. सो हमें ये जानना बहुत जरूरी है कि हाउ इन द डिफरेंट रीजन्स ऑफ द नेफ्रॉन हाउ रीएब्जॉर्प्शन ऑफ सोडियम इज टेकिंग प्लेस. सो जब हम इंडिविजुअल क्लास के बारे में डिस्कस करेंगे वी आर गोइंग टू टेल यू कि हाउ दिस सोडियम इज गेटिंग रीएब्जॉर्ब. बेसिक मैकेनिज्म देखेंगे, एंड उसके बाद जब हम डायूरेटिक एजेंट देते हैं हाउ दैट द सोडियम का रीएब्जॉर्प्शन हम रोकते हैं, एंड बाय स्टॉपिंग दैट रीएब्जॉर्प्शन ऑफ सोडियम इज गेटिंग एलिमिनेटेड आउट इन अवर यूरिन. नाउ द नेक्स्ट थिंग दैट वी आर गोइंग टू फोकस इज अबाउट द बेसिक क्लासिफिकेशन ऑफ आवर डायूरेटिक एजेंट. नाउ वी कैन ब्रॉडली क्लासिफाई आवर डायूरेटिक एजेंट इनटू 5 मेन कैटेगरीज. The very first class of a diuretic is known as carbonic anhydrase inhibitor. Now ये जो carbonic anhydrase inhibitors होते हैं they are mainly working on our proximal convoluted tubule that is representing our site A. जो second class of diuretic agent होता है that is known as loop diuretics. Now ये जो loop diuretics होता है it is mainly working on our thick ascending limb of loop of Henle. So here is our site B where our loop diuretics are acting. Then we have third important class of diuretic agent, and that is known as thiazide diuretics, and it is mainly working on our distal convoluted tubule. So here is our distal convoluted tubule and this is representing our site C. Then we have potassium sparing diuretics and ये जो potassium sparing diuretics होते हैं, they are mainly working on our collecting tubule which is also known as a collecting duct and represented as site D. Then we have a very important diuretic agent and that is known as osmotic diuretic. Now ये जो osmotic diuretic होता है, it is not having any specific site जहाँ पे ये अपना action show करता है. It can work on our entire nephron regions. So ऐसे जो diuretics होते हैं, which is not having any specific site, which can act on any region of our nephron, such diuretics are known as non-specific diuretics. And one such class of diuretics is known as osmotic diuretics. On the other hand, जब हम कार्बोनिक एनहाइड्रेस इनहिबिटर्स की बात करते हैं, थायाजाइड डायूरेटिक्स की बात करते हैं, पोटेशियम स्पेरिंग डायूरेटिक्स की बात करते हैं एंड लूप डायूरेटिक्स की बात करते हैं, they are specifically working on a particular region on the nephron. So ऐसे जो डायूरेटिक्स होते हैं which is having a specific site to work on the nephron, ऐसे डायूरेटिक्स को हम बोलते हैं specific diuretics. So we are going to understand, we are starting with the very first important class of diuretic agent and that is known as carbonic anhydrase inhibitors. So हमने बेसिक में अभी पढ़ा कि ये जो कार्बोनिक एनहाइड्रेस इनहिबिटर्स होते हैं, they are mainly working on our proximal convoluted tubule. So this particular image is representing our proximal convoluted tubule. Now, जैसा कि हमने बोला था कि diuretics are those agents which are promoting the excretion of sodium. So हमें पहले ये पता होना चाहिए कि proximal convoluted tubule में जब ये सोडियम आता है, how this sodium is getting reabsorbed back into the cell, because we know that 99% of the filtrate is getting reabsorbed. Now this is our sodium and here is our bicarbonate ions. Now this side is representing the lumen of a proximal convoluted tubule. If you are not understanding, what do we understand by the lumen? So lumen is nothing but it is the hollow space जहाँ पे ये filtrate आता है. So lumen is nothing but it is representing our hollow space in the nephron. Now ये जो proximal convoluted tubule के आजू बाजू में कुछ cells होंगे. Now there are two important terminologies we need to be very clear. So as you can see on your screen, here is our proximal convoluted tubule and यहाँ पे proximal convoluted tubule के surrounding there will be presence of different types of cells. Now ये जो site of cells होती है which is facing our lumen, this is known as luminal side of cell and इसके जो पीछे वाली side होती है that is representing our basolateral side. Now जब हमारा filtrate आता है, in that filtrate we have the presence of sodium and bicarbonate ion. Now I have a very interesting question for you. अगर हमें सोडियम का reabsorption करना है, do you think कि ये जो सोडियम है it can directly be taken by our cells? The answer is no. Our cells cannot take this sodium. Now the question is why our cells are not taking this sodium directly? We know कि our sodium is a charged molecule and हमारा जो cell membrane होता है it does not allow the charged molecule to enter into that particular cell. So sodium को अगर अंदर जाना है it need to have certain kind of carrier proteins and ये जो carrier होता है that is known as sodium hydrogen antiport system. So here this star is representing our sodium hydrogen antiporter. यहाँ से क्या होगा, जो सोडियम luminance की साइड में है, this particular sodium is getting reabsorbed into this particular cell in the exchange of one hydrogen getting released from this cell inside this particular lumen. Now जब ये hydrogen molecule lumen में आता है, this hydrogen molecule is getting combined with our bicarbonate ion and ये combination से एक important acid बनता है and that is known as carbonic acid which is represented as H2CO3. Now ये जो कार्बोनिक एसिड है in the presence of a very important enzyme that is known as carbonic anhydrase, it is getting converted into CO2 and H2O. Now ये जो CO2 and H2O होता है it can easily pass through our cell membrane. So यहाँ से ये सेल के अंदर चला जाएगा. Now when it is entering into our cell, once again this carbonic anhydrase enzyme is going to act and it is once again going to convert this particular H2O and CO2 into carbonic acid. And ये जो carbonic acid होता है it will further get degraded into bicarbonate ions and H+. Now what is the importance of this particular step? We know कि अगर ये पंप को हमें ऑपरेट करना है, सोडियम जब अंदर आता है, one hydrogen is getting lost from this particular side to our lumen. So ये जो हाइड्रोजन यहाँ पे बना, it can be utilized for the operation of our sodium hydrogen antiport system. And ये जो bicarbonate होता है with the certain important transporters which are present on our basolateral surface, ये जो bicarbonate है it is getting reabsorbed back into our blood. Now ये जो bicarbonate होता है it is playing a very important role. Now हमें ये पता है कि ये जो बाइकार्बोनेट होता है इट इज अ बेसिक इन नेचर. सो जब भी ये बाइकार्बोनेट हमारे ब्लड में आएगा इट इज गोइंग टू मेंटेन अवर पीएच ऑफ अवर ब्लड टुवर्ड्स द बेसिक साइड, और वी कैन से इट इज हेल्पिंग अवर ब्लड टू मेंटेन इट्स पीएच एट द अल्कलाइन रीजन. सो रिमेंबर दैट. नाउ आई हैव अ नेक्स्ट पर्टिकुलर क्वेश्चन कि अगर ये सोडियम को सेल के अंदर आना है, should that the sodium concentration inside this cell should be more or should be less? The answer is the sodium concentration in this cell we have to keep it low. Now the question is why in this cell we need to keep the sodium concentration low? हमें ये पता है कि our molecules love to move from the higher concentration gradient to the concentration of lower gradient. So अगर हमने सेल में सोडियम का concentration ज्यादा रखा, whatever sodium is coming into our lumen, that sodium will not love as the concentration in the cell is high. So we need some kind of mechanism जहाँ पे constantly we are keeping the concentration of sodium inside the cell low. So यहाँ पे एक important pump काम करता है and that name of that pump is sodium potassium ATPases. Now ये क्या करता है? It is constantly taking 3 sodium out of the cell and in exchange it is putting 2 potassium inside the cell. So with the operation of this particular pump, जो sodium है that is constantly thrown out of this cell, so the concentration of sodium in this cell is low. Now ये जो हमने mechanism पढ़ा, it was about how this basic understanding के ये जो सोडियम है how it is getting reabsorbed back into our cell. Now अगर हम किसी पेशेंट में if we block the activity of this particular enzyme, that is carbonic anhydrase की activity अगर हमने block कर दी, let us see what will be its effect. Now if we block the activity of our carbonic anhydrase enzyme, do you think कि ये जो carbonic acid बन रहा था and it was getting degraded into CO2 and H2O in the presence of our enzyme carbonic anhydrase will take place? The answer is no. Why? Because ये जो carbonic anhydrase की activity है ये हमने block कर दी. So there will be no production of CO2 and H2O. If there is no production of CO2 and H2O, ये CO2 and H2O in normal condition सेल के अंदर जाते थे. Now, as the production of CO2 and H2O नहीं हो पा रहा है, the CO2 and H2O will not be able to enter into our cell. This is one thing. Now, अगर आपका क्वेश्चन ये हो सकता है कि अगर CO2 and H2O सेल के अंदर प्रेजेंट होंगे तो उसका क्या होगा? रिमेंबर कि जब हमने बेसिक क्लासिफिकेशन या फिर बेसिक जो हमने पढ़ा था वहां पे हमने देखा था कि CO2 and H2O is getting combined to form once again carbonic acid in the presence of our wonderful enzyme that is carbonic anhydrase. So यहाँ पे we have blocked the activity of our enzyme that is carbonic anhydrase. So अगर सेल में CO2 and H2O पहले से प्रेजेंट भी हुआ the CO2 and H2O is not getting converted back into our carbonic acid. Now, अगर carbonic acid नहीं बना, in normal condition, what was happening? कि ये जो carbonic acid है, it was spontaneously once again getting divided into two important ions, that is H plus ions and bicarbonate ions. So अगर carbonic anhydrase की activity हमने block कर दी, there will be no production of H2CO3, and अगर H2CO3 ही नहीं बना, there will be no production of H plus and bicarbonate ions. Now think कि अगर H plus ions नहीं बने, this particular pump is constantly requiring the amount of H plus to be thrown out into the lumen. So अगर H plus ही नहीं बना, अगर सोडियम अंदर भी आना चाहता है, this particular sodium cannot enter because जब ये सोडियम सेल के अंदर आता है, one hydrogen this particular cell is throwing out into the lumen. So as by giving carbonic anhydrase inhibitors, we are not producing H plus ions. So ultimately, जो final result होगा, we are failing the operation of this particular pump. So H plus बाहर नहीं जा पाएगा. This is number one thing. Now number two, अगर H plus बाहर नहीं जा पाएगा, तो ये जो bicarbonate ion है, will not be able to react with our H plus ions. So ये जो bicarbonate ions होगा, that will be moving into the further regions of our nephron, and same will be the case of sodium. Sodium अगर यहाँ से अंदर नहीं जा पाएगा, this particular sodium will then travel into the further regions of nephron, that is loop of Henle में जाएगा, distal convoluted tubule में जाएगा, collecting tubule में जाएगा, and ultimately ये जो sodium है, that will be getting eliminated out from our body in the urine. And हमें ये पता है कि जब सोडियम एलिमिनेट आउट होता है, सोडियम इज ऑलवेज फॉलोड बाय वाटर. सो सोडियम के एक्सक्रीशन के साथ वाटर भी एलिमिनेट आउट होगा. सो वी हैव अचीव्ड आवर diuresis effect, and this is the mechanism of action of our very first important class of diuretic agent, that is known as carbonic anhydrase inhibitors. Now यहाँ पे जो bicarbonate ions है, उसका भी elimination out होगा in the urine. So can we guess an important side effect of our carbonic anhydrase inhibitors? Now ये जो carbonic anhydrase inhibitors होते हैं, this is promoting the loss of bicarbonate ions into our urine. Now ये जो bicarbonate ions होते हैं, they are basic in nature. So what it will do, it will change the pH of our urine slightly basic. यानी कि ये अल्कलाइन यूरिन का प्रमोशन करेगा. सो वन ऑफ द इंपॉर्टेंट साइड इफेक्ट ऑफ अवर कार्बोनिक एनहाइड्रेस इनहिबिटर इज इट इज प्रमोटिंग द अल्कलिनिटी ऑफ अवर यूरिन. यानी कि जो पीएच होगा ऑफ अवर यूरिन वो थोड़ा सा बेसिक साइड पे होगा. नाउ अगर यूरिन में कॉन्सेंट्रेशन ऑफ बाइकार्बोनेट आयन ज्यादा है, दैट मीन्स जो ब्लड में कॉन्सेंट्रेशन ऑफ बाइकार्बोनेट आयंस है वो कम हो जाएगा. एंड हमें ये पता है कि ये जो बाइकार्बोनेट आयंस है वो बॉडी में क्या करते थे, इट वाज मेंटेनिंग द पीएच ऑफ आवर बॉडी फ्लूइड, दैट इज द ब्लड, टुवर्ड्स द मोर बेसिक साइड. यानी कि अल्कलाइन रीजन पे ये पीएच मेंटेन करते थे. नाउ एज द बाइकार्बोनेट आयंस आर गेटिंग मोर एलिमिनेटेड आउट इनटू द यूरिन, सो रिलेटिवली जो कॉन्सेंट्रेशन ऑफ बाइकार्बोनेट आयंस होगा इन आवर ब्लड, that will be reduced. So जो pH है that will move towards the more acidic side, and one of the side effect is our metabolic acidosis. So remember that कि अगर bicarbonate ions यूरिन में ज्यादा प्रेजेंट होंगे, it will cause the alkalinity nature of our urine, and अगर bicarbonate ions ज्यादा यूरिन में एक्सक्रीट आउट होंगे, so relatively जो concentration of bicarbonate ions होगा ब्लड में वो कम हो जाएगा. एंड बिकॉज ऑफ दैट जो हमारा बॉडी का ब्लड पीएच होगा वो थोड़ा सा एसिडिक हो जाएगा. एंड दिस पर्टिकुलर कंडीशन इज नोन एज मेटाबॉलिक एसिडोसिस. सो दिस आर द टू इंपॉर्टेंट साइड इफेक्ट्स. नाउ यही साइड इफेक्ट्स को हम अपने थेराप्यूटिक यूजेज में अप्लाई कर सकते हैं. सो दैट्स इट फॉर टुडेज वीडियो लेक्चर. In the next video lecture, we are going to see the therapeutic application of our carbonic anhydrase inhibitor. We will also see the contraindication, यानी कि ये कार्बोनिक एनहाइड्रेस इनहिबिटर कौन से कंडीशन में हमें नहीं देने हैं पेशेंट को, वो भी हम डिस्कस करेंगे. We are also going to discuss the name of different drugs which are coming into the category of our carbonic anhydrase inhibitors. So, see you in the next video. Till then, see ya, bye bye, have a good day.